COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, and food assistance. COVID-19 recovery.
Hi, I'm Kelly Vaughn, and welcome to COVID-19 Recovery. Joining me on the show today is
Al Bracken with CAGI, and we'd like to welcome everybody this morning as we continue our series on looking at health disparities as it relates to COVID-19. We have a series of guests, and we are extremely honored to have with us this morning Dr. Stephanie Moss. And Dr. Moss is a PharmD pharmacist consultant extraordinaire, and she has been working with us for the last 6 to 8 months doing informational sessions in relation to the vaccine, the science behind the vaccine, and making clinical sense of all of this. And we are just ecstatic to have her here this morning. And so Dr. Moss, welcome. And before we get started, or as part of getting started, can you just tell us a little bit about yourself and your practice, and just how you got to where you're at, and what it took you, and what it takes to be a pharmacist? Can you go ahead and explain that a little bit for us?
Yeah, well, thank you both for having me. I'm so excited to be here today. And I'm glad you asked me about pharmacists, because a lot of people have, like you said, misconceptions about what a pharmacist is, what does it take to be a pharmacist, and things that pharmacists can do. So my name is Dr. Stephanie Young Moss, and I am a research pharmacist. So I am the one that looks at particular medications and makes sure that they're actually doing what they said that they would do. So if we said that it's going to reduce a cost on a certain medical claim, or if it's going to help you get better, help you not go to the ER as much, I have to be able to prove those types of things in research. So I've been different types of pharmacists. I've been a community pharmacist, which are the pharmacists that you see in like your Walgreens or CVS and different other drugstores, your local drugstores community. And I've also been in managed care pharmacy. And currently, like I said, I'm in research pharmacy. So there are different things that you can do as a pharmacist. A lot of people think that you can only work at your local community pharmacy, and those pharmacists are very, very helpful and needed in the community. But there's thousands of things that pharmacists can do. So I'm originally from Tennessee, and I went to school at Xavier University in New Orleans, Louisiana, where I received my PharmD. So it takes 4 years of undergrad and 2 years of graduate school in order for you to receive your doctorate of pharmacy. So we do various things where we study clinical outcomes, we study the medication. So we have to know everything about the drugs, everything about the disease states to be able to treat patients, or be able to know what to prescribe them. So when you come into a pharmacy, the pharmacists, they aren't just filling your pills or putting the pills in the bottles and giving them to you. They make sure that you don't have drug interactions. They're making sure that you may not have other things that may harm you. And they have to make sure that they know the drugs. They look at your profile to see what you're on, and they're able to really use their expertise in helping patients that come into the pharmacy. So they actually can do a lot. And then you also have pharmacists that work in hospitals that are calculating dosages that you have to take as well. So when I was in school, I did various types of pharmacy as far as interning on what I wanted to do. So I went into like I said, community pharmacy. I did some work in hospital pharmacy in school as an intern. I also worked for a pharmaceutical company as an intern. And while doing that, once I graduated, I ended up doing a fellowship at a local pharmaceutical company here. And that is what piqued my interest into research. Especially research for when it comes to people of color, because a lot of times you don't have a lot of statistics on how a drug works or how a drug affects people of color, because you don't have as many people in those clinical trials. So it's good for us to be able to show how it works and what it does, so that we can also receive the benefit, or if there needs to be something that's tweaked or changed, we can look at that too. So I've been doing that for over 20 years. And I also focus on health disparities as well. I'm on a local board for a local clinic where I help address health disparities and people who, and advocate for those who can't advocate for themselves. So There's various things that you can do as a pharmacist. Like I said, it takes 6 years, and I love my career. I love being a healthcare professional, even though it's in a different way that people may not think about, but I actually enjoy being a healthcare professional very much.
Excellent, excellent. Can you, I think our audience can see why I wanted you to go through that, because as we look at vaccine hesitancy and all the issues that we're hearing, the side issues onto why individuals don't want to take the shot or get the vaccine, we want to hear from a professional that this is what you do every day. And what Dr. Moss has been doing for CAGI is doing educational seminars, all on Zoom, and answering questions in reference to the science behind the vaccine. So can you give us a brief synopsis or summary of some of the objections and what you have been hearing in reference to why folks are hesitant to take the vaccine and your subsequent responses to those objections?
Well, vaccines have been around for over 300 years. We've all taken just about, I think we've all taken just about, we've taken different types of vaccines throughout our lifetime, whether it's to go to school or to work or whatever, but there's been a long history, and we have advanced in the way that we have actually developed them over the years. So the technology has become more savvy. There's a lot of research, a lot of money put into the research for different vaccines to make sure that they are safe and effective. So a lot of people say, well, why do we have to have vaccines? One thing is that, of course, vaccines can help prolong life. It can help take some of the strain and stress off our healthcare system. So all of those things are very important. And if you look at, you can also eradicate diseases that are very, very harmful and dangerous to people. So for example, if you look at the polio vaccine, for the polio vaccine, this polio was making kids either die or they making them paralyzed where they couldn't walk. And it was really affecting the world during that time. So as late as 1988, there were 350,000 cases of children in Europe with polio. So once the vaccine was introduced, which it has been introduced before then, but we started to eradicate the disease. Now most of the world is 99% rid of polio just because of the vaccine. So things like that it's important to show why we have vaccines and why they're important. So there are only 22 cases of polio since 2017, which is very important. So a lot of things I hear from people when it comes to the COVID vaccine is, well, first of all, it's not FDA approved. So why would I take something that's not FDA approved? You hear that all the time. Well, it did receive an emergency authorization use at first, which is a product is developed and given emergency use because there is a public health emergency. So they allowed it to have that after they made sure that it was safe and effective. And had to meet other FDA requirements as well before they gave it the actual FDA approval, which just happened, you saw over the past couple of weeks. So it is approved now. So I'm hoping that there aren't other objections or things that people are saying now, because the biggest one was that it's not FDA approved, but it is approved to be able to take. So I do get that a lot. But let's look at some things that are not FDA approved, other things that we take that are not FDA approved. Many vitamins, herbal things that people take, essential oils, none of those are FDA approved. So we have to think about, we are trusting those companies with vitamins that we take, but they are not FDA approved. Infant formula is not FDA approved, which is important. You know, we're giving our babies that, but it's not FDA approved. Cosmetics are not FDA approved. And then one of the biggest ones I'm hearing people say, sea moss is not FDA approved, but we are taking that, and a lot of people are saying that they're taking it to make sure they remain healthy. So a lot of things that we're taking, that we're ingesting in our body are not FDA approved, which we will bring up that objection for the vaccine. But there are several things that we take that are not FDA approved. Tattoos are not FDA approved.
Can I interject there, Dr. Moss? Because I think you make a very good point. And I've seen even on Facebook will say, well, you know what Doritos do to your body. You know what sugar and sweet potato pie does to your body, but you don't question that. And we know that we consume a lot of junk. That's the first point. Secondly, for example, I have used HCG, human chorionic gonadotropin, for weight loss, but it's approved for fertility. So there are a lot of drugs on the market that are not approved by the FDA for that purpose, but doctors are allowed to practice medicine. So a lot of times it's up to them. So there are a lot of things that have started off for one thing, and then we found out they worked for something else.
Correct.
And just like aspirin was for pain, now we find it's a blood thinner. And so I'm sure at one time aspirin was an official prescribed medicine at some point, probably historically, and then now it's used for a lot of other things. So that's not uncommon for a drug to not be approved by the FDA, but people use it for a different, purpose. And I might add too that the FDA approves a lot of drugs that we find out later have side effects.
That's true.
The territory. I mean, and so they're making it like, well, if the FDA approved it, it just must be 100% okay. I've come into a lot of drugs that I've used. It's like, this isn't working for me, or it's causing this or causing that. And we know there are tons of lawsuits. So there's nothing definite about any of it. We're practicing medicine.
Yep, I totally agree with that. So there have been drugs that once it gets out in the mass, you may see different things. I think that every drug does not work for everyone, and we know that. So, and everyone will react to medications differently. So once when a drug is released into the general population and more people take it, there are different things that people have, maybe different disease states, maybe different other things that could show up as well. So sometimes you will see a very small percentage of an adverse side effect that may not have been seen in a smaller group. But typically with the safety and effectiveness is what they're trying to make sure that they are guaranteeing.
Kelly, you make a great point. When part of my background is in working for pharmaceutical companies, and we run across physicians every day, and especially physicians that are prescribing some medications, as we say, off label, that only the physicians can do it. And what makes sense for all of us to, if we have hesitancy, to ask our providers, ask our healthcare professionals. And having said that, one of the things that CAGI is doing, one of the many things that CAGI is doing with the Community Pandemic Wellness Initiative, is partnering with the Shalom Clinic to do mobile vaccines, to do mobile outreach in reference to health education. And one of the things that we're finding out is that folks don't have providers. I'm sorry, go ahead, Kelly.
Okay. So I was going to say, and I love what you're saying about Shalom. We need to take a break. And then when we come back, we'll talk more about the mobile units, how CAGI is teaming with Shalom Healthcare Center here in Indianapolis when we come back.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
We're back here on COVID-19 recovery with our guest, Dr. Stephanie Young-Moss, who's a doctor of pharmacy. And we've been talking about, everything from the vaccine to just medications in general. And I know you were making a point, Al, about something that Community Action of Greater Indianapolis is doing in conjunction with Shalom Clinics.
Correct. One of the things that we're doing is getting out in the community, various senior apartment buildings, community events, et cetera, and offering the vaccine, in some cases with the initiatives incentives, and gathering information. One of the things we're finding out and I'm seeing this personally, is that we have a lot of our seniors that don't have providers, that don't have a primary care provider in their life. And if I ask a group of folks who is your primary care provider, whether it's a nurse practitioner or an MD, and over half the room can't give me an answer, then that's a fundamental problem that we have. That's why we partner with Shalom to assign a provider for those individuals. So part of the hesitancy that we're seeing is more so on procrastination in a lot of cases. And we're taking that mobile clinic out as far as seniors, we're getting a good response. So Dr. Moss, having said that, what do you see now as far as how Indiana is stacking up in the country, and what are we doing, and what should we be doing to get more people vaccinated?
Well, currently, as of a few days ago, we were ranked, Indiana was ranked 36 in the nation. So out of 51, we were ranked 36 with the number of people being fully vaccinated. So we have about 45 to 46% of people fully vaccinated. So number 1 being Vermont and number 51 being Alabama. So we're on the lower end with people being fully vaccinated. Now, it is increasing with how many people are receiving their first shot. So there has been an uptick here lately when people are starting to begin to get more vaccines, become vaccinated more. But right now we are 36. So it will take some grassroots efforts, like some of the things that you're doing. I think it's very good for people to see and talk to people who they trust and know and ask all the questions that they want to. And some people just need people to come to them as well, where they may not have time. I know a few people who say, well, it's not that I don't want it, I just don't have time to go get it. Well, I really think that when it comes to your health and your life, you need to really make time to get that shot, or we can reach out and go to the community as well to try and get people to educate them about the vaccine and to get them to take it as well.
Excellent. What kind of numbers are you seeing in the population of color, Black, Brown? What kind of vaccination numbers are you seeing? What you see, any trends, any recommendations, et cetera?
Yeah, now you will see for people of color, for Hispanics and Black Americans, we are seeing that we have more people who actually have the disease than people who have the vaccine, and when it comes to percent wise. So we need to do better on that. Now in the Asian communities, there are more people who are vaccinated versus those who have had the vaccine. So we really need to work on that, because we are seeing some of the disparities where you will see Black and Brown people who are affected more when it comes to infection, and then also in death rates. So for our population percentage, we may be at 12%, but then you only have 10% that are vaccinated, which is not good. So we need to make sure that we're increasing. When I say 10%, I mean 10% of the total that are vaccinated, excuse me. But we need to make sure that we are trying to increase that number, because when it comes to disparities, whether it's being able to locate the vaccine or diseases, we need to make sure that we're reaching those people that aren't getting the vaccine.
So what do you suppose people, even at this point, we've had one wave, now we're into a second wave, are not getting the vaccine? And I think initially we thought it was there was a political divide, but I know Don Lemon on CNN did an in-depth interview with actual patients in the hospital, went in with this long mic and interviewed people, and he was saying it wasn't just that people, a lot of it's just procrastination, just hadn't done it. Of course, some of the things that you talked about too, where maybe people aren't able, but what are you, and I guess this question is for both of you, because I know, Al, you go out and you help with that. And then Dr. Moss, what are you hearing from people, why they haven't done it? And especially those people who maybe have contracted it already.
Well, there's a lot of disinformation. I mean, a lot where people are hearing things or seeing certain videos that the information is just not true. So trying to dispel that and make sure we're educating people, and people not just looking at what they see on social media and making sure that they're investigating and reading it. Now, everything won't be in the terms that they can understand. So that's why it's important for us to make sure that we go and break that down for them as well. But a lot of people also may think, well, I've already had COVID, because there are a lot of people that have had COVID and that they don't need to get the vaccine. But we don't know how long that immunity lasts. And then there are variants that are here that could affect you differently. So there are certain things that people think they've had it, but that immunity may not last and they can get it. There have been instances where people have gotten COVID 2 or 3 times. and you don't know how it's going to affect you. People say, well, I'm healthy, I don't need it. You know, I do all the things I'm supposed to do. I'm young. And a lot of people are, they may not think that it can happen to them, right? You see the things on television, but they don't think it's going to affect them because they're healthy or they're young or they're whatever. But there are people who are healthy, they don't have other disease states affecting them, but you don't know how it's going to affect you. May not just be a cold. It could come in the form of a stroke. It could come in form of brain fog or organ failure. I mean, there's various things that COVID can do to you that we don't even know yet, because it's still considered a new and novel disease. So don't take it for granted that you're healthy and it won't affect you, because it can affect people who are healthy as well.
One of the things in conjunction with that is, and when we'll talk a little bit more about hesitancy, but one of the things that I'm seeing, not even from an anecdotal standpoint, but I'm actually seeing this in individuals, is the long-term effects that that is having. That individuals where they had a issue that was dormant, that they've been diagnosed with COVID, and the aftermath of it, that whatever that dormant condition was, came to the forefront, as that COVID pushed it to the forefront.
Yeah.
And a big question mark, a big unknown thing that's out there is what are the long-term effects of it. And one of the things I wanted to point out about the hesitancy side, and from what I'm hearing, that I do see that the reasons that folks aren't getting vaccinated, it varies by culture. Because European Americans, the predominant thing I'm hearing with them is that they want the freedom of choice. They don't want to be told that they don't want the government involved in their lives to be told that they have to take the vaccine. I've not heard that excuse or that reason from one person of color, not one. So the African Americans and Hispanic brothers and sisters has been more on the line of procrastination, and I'm healthy, and I don't think that I need the vaccine. I've heard not one individual say anything about the Tuskegee experiment of old. I haven't heard any of that, and it's been hesitancy based on other conditions and other issues. So, Dr. Moss, and I know if we keep talking like this, we're going to run out of time again. Can you talk a little bit about what you're seeing on the hospitalization rates? Because I know that it's extremely high among individuals that have not been vaccinated.
Yeah. So we are seeing with the new variants that's out, the Delta variant is out, but of course there are other variants that could possibly come up too. But with the Delta variant, you are seeing 120% higher risk of hospitalization, period. 287% higher risk of being in the ICU, and 130% higher risk of death. That's just with the Delta variant. But when it comes to vaccinated and unvaccinated individuals, in Indiana, of all cases just this year, only 2.4% have occurred in patients who are vaccinated. 97.6% of cases are people who are unvaccinated. That's just with having COVID this year. And for hospitalization, 1.4% of those patients have been vaccinated, and that leaves 98% of the patients who are being hospitalized for COVID this year are unvaccinated. And for deaths, 1.3% of people who have been vaccinated have died this year from COVID, and 98.7% of the patients who have died this year from COVID were unvaccinated. So if you see that statistic, that is very shocking and overwhelming of how much the vaccine can help you. Even if you do get sick and you do get COVID, it's decreasing your chances of being hospitalized and dying from the disease.
Okay.
Those numbers are
Got just
stunning.
about 2 minutes left. So Al, I'm going to let you wrap it up here for our show here on COVID-19 recovery.
Well, just one more quick question as a wrap up. I just want Dr. Moss to tell us real quick to answer if it's worth it to get the vaccine because of the Delta variant.
Yes, I think even from those numbers, I think it is worth it to get it. Even before the Delta variant, just looking at those numbers alone, that it can really help you, it can save your life. And even if you're asymptomatic, you don't want to pass it on to someone else, that it can really affect them. So it is worth it to save yourself and also your community and your family.
Excellent. Again, thank you, Dr. Moss, for being on. Man, you've got so much information. It would be interesting, Kelly, if at some point in the near future, we could bring on a person that is an anti-vaxxer or there's some anti-vaccine and bring them on at the same time with Dr. Moss. And we can have a question session for a live person that is talking about why they're not getting the vaccine. And I look at Kelly's face and she's looking like she wanted to bring, that was her idea in the first place. So I just stole it on air, but I'm all for it because our stance is that we want folks, and I'm speaking for CAGI. We really want folks to take the vaccine. The numbers bear it. I did terrible in biostats at Indiana State, but the numbers don't lie. I understand those numbers and everybody else should also. So having said that, again, thanks, Dr. Moss and Kelly. Any other words of wisdom? If
No,
not, we could go ahead.
I appreciate you coming on, Dr. Moss. And again, I warned you, Al, we should have done two straight shows. Sir. So will you come back? That's the question.
Yes, I will. I will come back.
Okay, we appreciate you so much, Dr. Moss.
Thank you
so much for joining us here on COVID-19 Recovery. I'm Kelly Vaughn.
And I'm Al Bracken.
We'll see you next time. Bye-bye.
Bye-bye.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.
We all have the ability to touch the lives of those around us. Sometimes, even the smallest act has the power to change a life.
Hi, Dad.
Reach out to the veterans in your life today. Let them know they're not alone. That's the power of one. One simple act can make all the difference.